So people are our business and we need them to be at work to be able to deliver for our customers. So it's really, really important to us that we get ahead of the trends with preventative measures.
Your experiences are certainly not uncommon. In fact, 77% of UK SMEs say that they plan to overhaul their employees' benefits in order to better tackle workforce health and wellbeing.
There's some really interesting stats around prevention and how much return on investment there is for investing in prevention versus paying for reactive treatment and care.
I think we've seen our productivity increase drastically over the last few years, and we've seen that our sick days have actually decreased.
I know from employing people myself that definitely there is a temptation to put that to the bottom of the pile. You know, actually everything's okay right now. But when you say something like that, that really makes me as an employer sort of wake up and think, actually, let me get ahead of this. Hello and welcome to the first episode in the brand new series of the Bupa Small Business Academy, where today we'll be exploring the link between preventative health and small business productivity and growth. I'm Holly Tucker, founder of Not on the High Street and Holly & Co. And today I'm joined by Amy Reid, the Global People and Culture Director for Mintra. Welcome, Amy. It's lovely to have you here.
Thanks. It's great to be here.
Amy, we're going to talk more about Mintra and your specific experiences when it comes to this health topic shortly. But I'd like to start by framing this conversation. An FSB report late last year revealed that just 6% of small businesses said that they plan to increase their employees' numbers in the next 3 months, while 1 in 5, so that's 20%, said that they would have to cut their staff levels. So, Amy, it's clear that if small and medium-sized businesses like ours can't take on and increase that headcount to drive growth, then we have to do our utmost to protect, don't we, and maximise the workforce we already have.
Yeah, I think it's really, really important that we at Mintra say people are our business, it's our first core value, and we really mean it. We want people to come to work, we want them to be their best selves at work and really deliver for our customers as well. So it's really, really important to us that we get ahead of the trends with preventative measures.
Let's move on to Mintra now. Can you tell me a little bit more about the actual company and what you do and how do you make up your workforce?
So Mintra is a technology company. We provide solutions to safety critical industries to allow them to deliver and develop their people, both in maritime and energy, through a variety of software solutions. Our people are split from people early careers in their 20s all the way up to retirement age in their 60s. We're looking to deliver a number of initiatives throughout different generations that come across different challenges. We need people to be their best selves. We need people to really deliver for us. We're a small organisation. We've got a small head count. And we need to be able to deliver our resources or deploy our resources effectively to deliver our solutions.
And with that in mind, what are the most common challenges you face when it comes to your workforce's health and wellbeing?
So since COVID, we've had a more remote workforce. People aren't coming into the office in the same way. So we've seen quite a lot of challenges around health and wellbeing, in particular musculoskeletal injuries, people doing repetitive tasks at work, maybe their setup not being quite correct, not having the right ergonomic setup for them being able to do the computer work. And also people were working from home, we have a more remote workforce and people are working and they're not able to switch off in the same way. It's easy to log back on, it's easy to just do a little bit more, we'll just finish that task. So really actually trying to address those issues and get people to have a better work-life balance has been really, really tricky.
Your experiences are certainly not uncommon, and it's something that a huge amount of SMEs are having to address. Actually, in fact, 77% of UK SMEs say that they plan to overhaul their employees' benefits in order to better tackle workforce health and wellbeing. I'm wondering, can you tell me how Mintra supports your employees' health and wellbeing and examples of the benefits that you've put in place?
Yeah, so we've got a wide range of benefits in place. We've got an employee assistance programme that people can reach out to if they're going through a difficult time and need to find some solutions. We also have things like online digital gym memberships that people can go and take part in gym classes like yoga or, work out with weights, etc. We also have physical gym memberships that people can access through discounted schemes to join a gym and get physically healthy. We have also offered some online versions of different sort of social meets, like coffee mornings, team get-togethers, social Tuesdays. We've done a range of different initiatives to try and get people that are remote to join in and also feel like they're part of the wider team and connect with them.
And I think you also mentioned before when we were chatting that you have is that a WhatsApp that is as well?
Yep. So as part of the employee assistance programme, there's a WhatsApp channel that they can reach out to and they can get an immediate response if they need help at that time.
That's
we
amazing.
also have, we've got quite an active social channel within Mintra. So we've got a SharePoint page where it can be signposted to how to get help, how to access the resources, how to access our benefits. But as part of that, there is constant chatter back and forward as well from the team about how they can help each other and jokes depending on what's going on that day and what events there are within the organisation.
So you're actually building a culture as well within that communication.
Yeah, and I think that's part of what we want to do is bring wellbeing into our culture so that everybody looks out for each other and we've all got a part to play in it. It's not just the leadership of the company, it's every individual within the organisation. We established a care team a couple of years ago, and that's an employee-led initiative, and that really allows employees to drive the wellbeing culture as well within and drive the employee engagement within the organisation. They've done a range of different things. So we've taken World Down Syndrome Day, for example, and had some initiatives around that and fundraise for charity as well through that. We've done some beach clear-ups and things like that where people have volunteered their own time out with work to go and meet up and deliver those initiatives. And then we've also done some things like the virtual coffee mornings or get together to play an online game and just have some fun.
That's amazing. We'll be talking to a Bupa clinician later about exactly what Bupa offer, but it would be great to understand more about which services your employees find most beneficial.
So I think one of the real benefits has been the GP access and being able to access a GP at a time that suits them at their convenience to talk about a health problem. And that's been really good from a work perspective as well, because they're not taking time out of their day to go and sit in a waiting room. So that's been one of the big, huge benefits. The other thing has been around accessing the counselling and the mental wellbeing services and then being able to access them when you need them at the moment of crisis.
Yeah, amazing. So we've spoken about the sorts of health and wellbeing challenges you face at Mintra and the benefits you have for when these arise. But I'm fascinated to know more about the preventative initiatives you've put in place to try and get sort of ahead of these challenges before they become a longer term problem.
We've established mental health first aiders. We went through some training a couple of years ago so that we've got some focal points on the ground that are able to identify and to help at that crisis point to stop things escalating. We have counselling services that people can access through the EAP and through Bupa. People can be referred and go in and talk to somebody when they need to, which helps to allow them to come to work and continue to work while getting treatment around their schedule and what works for them.
Yeah, and wonderful. So getting ahead of that issue that might arise with these pieces of support that you've created, it must be an amazing thing to witness in your position, people being proactive and getting that help.
Yeah, I think we've seen our productivity increase drastically over the last few years, and we've seen that our sick days have actually decreased. And I think an awful lot of that's to do with the benefits that we've got, but also to do with the employee engagement initiatives that we've got. And people want to come to work, they want to bring themselves best selves to work, and they really want to deliver for the customers, and that's really exciting to be part of.
Wonderful. Would you be able to share some case studies of how you supported certain employees when they were facing a health and wellbeing issue and the impact that had both on the individual and the wider business?
Yes, definitely. So one of the things that we have seen is that people remote working from home, their desk setup maybe isn't quite as good as it should be. They've maybe done an ergonomic risk assessment, but they've maybe not realised that they've had some challenges around that, and they're maybe not working as best as they can be in that workspace. So out of that, what we have seen is that people will access the ergonomic risk assessments that we have, and they'll also maybe do things like physiotherapy through Bupa. So we had a case study last year where one of our employees was working from home. He was working remotely. He had a bad back. He didn't realise that his workstation was actually contributing to that. And he was spending a long period of time at his workstation working on Teams calls, on programming, writing code, and he was finding that he was sitting really quite hunched up. The monitor wasn't at the right height. He didn't have the right sort of mouse to be able to allow his movement to be quite natural. So we did an ergonomic risk assessment. We put adjustments in place for him to be more reasonable, and he also accessed physiotherapy through Bupa to help with that. And also, with people working from home and being socially isolated, we don't have the same connection, so people are not connecting in the same way. So we're seeing a rise in mental health challenges around that.
I think it's also amazing, isn't it? I think for the team to witness someone that they know might be having issues, gaining that support, it's great for the overall morale.
Yeah, I think it really boosts the team and the team spirit and the collaboration, which it just goes to show people really do care for each other and they want the best for each other, and it's a nice feeling to have. I think we've also seen it physically when people have had an illness and they've had some time off from work, being able to access the benefit or to get the prescription quicker and be able to return to work quicker. The team can see the benefit of that as well, and that really pulls through as well, I think.
Yeah, absolutely. Amy, thank you so much. It's been so insightful. We often talk about businesses, what they should be doing, but it's actually fascinating to hear what Mintra are actually doing and the positive impact that this has had both on the employees and the business. So thank you so much for sharing.
Oh, thank you.
I'm now joined by Dr. Robin Clark, Medical Director for Bupa Global and UK Insurance, who is responsible for ensuring Bupa members have access to the highest quality health services that deliver the best customer experience. Robin, welcome.
Thank you.
Robin, before we dive into some of the specifics around what Bupa offers, I'd like to start by getting your perspective on why preventative health should matter to SME owners like me.
Yeah, prevention it's really important. And that's one of the reasons why you'll often hear doctors talking about why prevention is better than cure. So I think from a patient's perspective, the argument's quite clear that if you can identify something early, potentially you can stop a disease from happening, or if you diagnose it early, they may need less treatment. From the perspective of a small business owner, similar logic applies in that actually, if you're able to keep your employees at work for longer or actually reduce the length of time that they need off, then that's better for everybody. It's better for productivity, and it's also better for the employee as well. And when you look at prevention and investment in prevention, mental health is a really good example, because for every £1 you invest in it, you get £4.70 back as your return on investment. So there's a really great investment case there for prevention, particularly in the mental health space, which, as we heard, there's an increasing burden. And we've got to keep an eye out for that.
And when Amy was here, she was talking about that in terms of that increase that's within her company for mental health issues. And I know from employing people myself that definitely there is a temptation when things are so busy. You might be trying to meet your targets. Things aren't going to plan. It feels like there's not enough hours in the day. To put that to the bottom of the pile, actually everything's okay right now. Don't think we have to do anything. Maybe we'll just shift that to next year. But when you say something like that statistic, that really makes me as an employer sort of wake up and think, actually, let me get ahead of this. Let me put that £1 in and practically get £5 back. Because actually, at the end of the day, the only the person that's going to pay is that person that's going through that issue, but it's going to be the business at large. It's going to be something that I, as an employer, will have to deal with ultimately. Is that right? Is that you must see this all the time?
Yeah, absolutely. And I think it's funny because if someone else offered you that sort of return on investment elsewhere,
I'd be all in.
Absolutely, you'd bite their arm off.
I would indeed. I know from previous conversations with Bupa clinicians that when it comes to prevention, personalisation is the word that comes up a lot. Can you tell me a little bit more about what that actually entails and what that means for the decision makers within small businesses?
Personalisation is all about really understanding the individual differences and then being able to take actions or make decisions based on those differences. So within my world, within Bupa, we've got a service called My Genomic Health, and that's a really great service. And in terms of personalisation, some examples of that. So we've got medication check, whereby we look at people's DNA and we check them for over 100 medications as to how they will personally respond to those medications should they be given them. As a result of that, we can see which medications will work for them and which won't. Equally, we can see which are most likely to give them side effects, for instance. So you can easily understand from that example how then a doctor or a patient can make a suitable personalised treatment decision as to whether to take a particular medication or not. So that's really, I think, a great example of where personalisation comes in. The second thing that we have in a similar vein is DNA health check. And what that does, it takes the risk assessment from a health assessment and we combine it with someone's genetic risk. And so together what we can see is someone's personalised risk profile as a result. So what we can do is give them a very personalised view of what their risk is of cancer, heart disease, or diabetes. So as a result of that, there are certain actions that you may wish to take. So it may be that having screening is appropriate or having screening earlier or more frequently. And those are decisions that you can make based on that personalised health profile. Similarly, it may be that actually treatment is recommended and you can start treatment on the basis of it. So again, it's about very much fine-tuning the actions based on the individual, based on really who they are and ultimately back to their DNA.
I think also what's amazing is that from an employer's point of view, being able to give that service to my employees, that personal level, it really shows that care. It's that next step, isn't it? That next depth. It's not just healthcare. It's sort of that personal side of it that really has that impact. It's amazing. I know from experience that finding the time to attend, or actually, let's be honest, to even book appointments can be challenging when you work for an SME. We're rather busy all the time. And with small teams, we've got packed schedules. But how do Bupa help take that stress away?
So within Bupa, we've got the My Bupa app, which gives you access to Blua. And Blua is Bupa's expert digital health service. And through that, you can access the digital GP service, there's physio, and there's mental health support on there as well. So those are services that are accessed quite a lot, and there's a really good benefit from doing that. As you say, accessibility is definitely one of the plus points there. And as a result of that, it's one of our most widely used services. The other content that you can access through the app is wellbeing. So there's a lot of really great wellbeing content, and that's really helpful for prevention as well. So, for instance, there are exercise classes, there's things to do with like nutrition and recipes on there. So lots of things that people can access to keep themselves healthy, keep them in that sort of real well-being zone.
And for when more light touch advice is required, I know Bupa partner with Jack, which stands for Just Ask a Question, which I'm a big fan of. Tell me more about it.
Yeah, so Jack is this really great platform with some quite innovative contents. There's some interactive videos on there, and they've been recorded by experts in their field. So it's clinicians, there's some Bupa members of staff there, there's wellbeing experts, even some celebrities on there as well. And there's really rich content around the mental health, around the mental health space. So everything on there to do with anxiety, grief, relationships, topics like that. So it's some really engaging content. In terms of what we can do once people have used that service is by anonymising some insights, we can see what people's demands are locally, and as a result of which, we can then help tailor people's wellbeing services to their employee base. So there's a really nice sort of circular loop that we can pull together as a result of that service.
That's really clever. And how about the other free online resources that are available to help people deal with workplace health and wellbeing issues?
We've got Growth Plus, which is an all-in-one HR health and wellbeing support service. So that's tailored to the needs of small businesses. And we've also got the Workplace Academy webpage, which is a free resource for line managers, which contains bite-sized videos and guides, which can really help with supporting employees and understanding their different needs.
Well, I'm taking that away. Thank you very much, Robin. It's great to hear more about all the great things Bupa offer to support SME owners in protecting their employees. Thanks for joining us.
No, thank you.
That's all we've got time for today. Thanks to Amy and to Robin for sharing all their insights and experience on how preventative health can help SMEs to drive growth and productivity. Take care, and we'll see you next time.